Hello class and welcome to another exciting facilitation for this semester. I am Dr. Annie George, Department of Public Health, Faculty of Health Sciences, and will be your guide. Hope we all enjoy it. Thank you.
Hi students, welcome to another facilitation session on essential drugs, PHS 426. Last week on topic 5, we looked at um, the concept of essential drug revolving system, drug revolving fund. We looked at the concept of that drug revolving fund, the elements of the drug revolving fund, the main essence of the drug revolving fund, and how it is actualized. We looked at the drug financing system, the drug supply system, and all that. So this week we'll be looking at topic 6, and we'll dwell more on the classification of other drugs of public health importance. So at the end of this lesson, we should get to know other drugs of public health importance, understand other routes of administration of these drugs and their side effects, so that that will guide us appropriately. So what are the drugs that are in this category of uh, you know this category? What are the drugs that are in this category of drugs of public health importance at that level, other categories or other aspects of drugs? Such drugs are usually selected for use in primary healthcare centers. They are used to treat conditions that are common in rural areas, especially among women, children, and the elderly. This is how we categorize drugs in these aspects of public health. First, they are used in primary healthcare centers, and primary healthcare centers are usually located mostly in rural areas because they help to treat conditions that are common in those areas, especially among women, children, and the elderly. So how do we classify these drugs? We classify them under antifungal drugs, antiviral drugs, and antihelmetic drugs. This is the way we classify them into these 3 classes. So antifungal drug lists. Let's look at antifungal drug lists. What is antifungal? Antifungal is used treating fungal infections, whether it's systemic fungal infection or localized fungal infections of the skin and other parts of the body, or systemic, like I said, which are internal fungal infections, or fungal infections that are localized, that are within the body, in the blood and all that. So such infections are treated with medications. Examples of such medications include amphotericin B, you have nystatin, we have griseofulvin, or griseofulvin, and then you have the flucytosine, we have the ketoconazole, miconazole, clotrimazole, and other zoles. These are medications that are antifungal medications that are in that antifungal drug list. So what are the examples of antiviral drug agents? Let's look at antiviral now. We've finished with antifungal drug list, so let's look at antiviral drug list. So the antiviral drug list or agents are used in treating viral infections. infections that are caused by viruses. And examples in this category are the amantadine, the ribavirin, and the acyclovir. These are the three major antiviral medications that are in this primary healthcare list: amantadine, ribavirin, and then the acyclovir. So we have another one called antihelmintic drugs. Antihelmintic drug lists, they are used for treating worm infections at the primary healthcare level. So we have the antifungal, we have the antiviral, now we have the antihelmintic. This is the third class of drugs in this category of medications that are in the primary healthcare list. The antihelmintics are used for worm infections, and examples of drugs in this category include piperazine, pyrentyl, mebendazole, albendazole, thiabendazole, and diethylcarbamazine. These are medications that are in this category. Now, let's look at these classes of medications, where the antifungal, antiviral, and the antihelminth. Let's look at their routes of administration and the side effects, the common side effects associated with these medications. So, like amphotericin B is usually given parenterally. It's given parenterally, intravenously, and then you have nystatin, griseofulvin, ketoconazole, and miconazole given orally. They are in oral preparations as tablets. You have clotrimazole, which comes in vaginal pessaries or vaginal tablets. These are the ways these medications are prepared, and their route of administration is either parenterally, orally, or as vaginal insertions, as the case may be. Then the common side effects for antifungal medications include nausea, vomiting, because most of them are given orally. You have they could lead to hepatotoxicity, hypersensitivity reactions such as anaphylactic reactions. They could also cause fevers, headaches, gastrointestinal disturbances, and could also lead to decreased renal functions and need to be monitored closely. And some of them could also come down, people who take them could come down with what we call thrombophlebitis. These are the side effects of antifungal medications. So the antiviral route of administration and side effects. We have the antiviral agents here. Zidovudine, amantadine are usually given orally. Then acyclovir could be given orally or intravenously. The common side effects of these medications, you have the amantadine, could cause confusion, it could cause hallucinations, seizures, and coma in people who take them. Ribavirin could lead to teratogenic and mutagenic effects, especially in women who are pregnant who take this medication. Acyclovir, because it's taken orally, could lead to nausea, vomiting, diarrhea, and headaches. And some could come down with skin rashes and then herpes. Then you have the zidovudine, could lead to anemia and neutropenia because of its effect on the bone marrow, and then can also cause headaches. These are the common symptoms of, side effects of these medications, antiviral medications. So what are the routes of administration of antihelmintic, anti-worm medicines? What are the routes of administration? Usually, the drugs that are in this category, like piperazine, uh, is given orally, pyrantel orally, mebendazole oral, diethylcarbamazine another oral route, um, and then you find out that most of the antihelminths are usually given orally, the anti-worm medicines, and the common side effects is usually the same in all of them. You could have nausea, vomiting, and abdominal pains because they are given orally. So in summary, learned drugs of public health importance, especially at the primary healthcare level, and we've understood their routes of administration and the common side effects. In our next lecture, we shall be looking at alcoholic beverages, uses, and abuse. Thank you for listening.